All right, I'm going to go ahead and get us started. So, hello everyone, welcome. My name is Zikea McCurdie. I'm the Director of Wellness Programs here at Wellness 360, and I'd love to welcome you to today's session on the Road to Wellbeing event series. So, this series is dedicated to empowering you as benefits managers and wellness leaders with the tools and knowledges needed to guide your employees on their journey to holistic well-being. Throughout the series, we'll explore practical tips, share some expert insights, and engage in interactive sessions that address the diverse needs of your workforce. So, in today's episode, we'll be featuring Sai Ganesamurthy, a seasoned entrepreneur and innovator with a proven track record in building exceptional consumer experiences. Holding 5 patents across diverse fields, including computer networking, mobile payments, and industrial process control, Saeed brings a unique perspective to the healthcare industry as the CEO of HealthFeed. So, a little bit more about what we're going to discuss today. In today's session, we'll dive into the critical topic of health equity. We're going to be focusing on how the Health Equity Index can be used to improve care for the most vulnerable populations. You'll gain valuable strategies to enhance engagement, address physical, mental, and financial well-being, and discover innovative approaches to elevate your existing wellness programs. And with that, I'll hand it over to Saeed. Saeed, take it away.
Awesome. Thanks, Zakia. I first want to start off by thanking the folks at Wellness 360 for giving me this opportunity to speak at this webinar. I'm very excited to talk about health equity. This is a topic that's near and dear to me. So, this is not only an important topic for the entire field of healthcare, but it's also an important topic for the overall well being of our entire society and community as well. So let's start off with a brief definition of what health equity is all about. Health equity is the concept that everybody has a fair and just chance of achieving their best possible health outcomes, no matter what race they belong to, what socioeconomic status they belong to, what age they belong to, what gender they belong to, or what is their sexual orientation, what their national origin is, what geography they belong to, so on and so forth. So before we go further, so let's kind of differentiate what health equity is and kind of spell out the key difference between health equity and another term that is usually confused with in the industry, and that happens to be health equality. Health equality is the concept that everybody has the same set of resources and opportunities to achieve their best possible health outcomes. Whereas health equity is slightly different. It kind of recognizes the fact that each one of these different groups or subgroups of populations that we're talking about have slightly different health needs. And so the resources that need to be allocated for each one of these groups that we're talking about needs to be slightly different as well. So that's the key difference between health equity and health equality. And I see a lot of people, equating the two, but they're not necessarily the same concepts. So let's go one level deeper. We'll look at health equity and we'll put it in perspective in terms of some numbers. Um, Black infants are twice as likely to die as that of white infants at the time of birth. Um, Hispanic populations have a much higher death rate due to diabetes than their white counterparts. And historically, people of color have had a disproportionate amount of hurdles that they have to overcome in order to access mental health resources. So that's sort of where we are in terms of health equity in our country. And the CMS has recognized this, and they've done a number of steps over the last several years under all of the three administrations under President Obama, President Trump, as well as President Biden. And the good news here is that the politics has stayed out of many of CMS's policy towards driving health equality, health equity disparities down to the minimum. So of notable mention are, they've done a number of community outreach programs over the last several years. They've done a number of, grants and funding proposals for a number of organizations to address health equity disparities. And there have been a number of legislations and policies that have been enacted as well. So the CMS is doing its part in, in kind of reducing health equity disparities. Next slide, please. Perfect. So now that we kind of understand health equity at a very high level, it's time now to go one level deeper and kind of try to see how we can actually quantify health equity, right? And that's where the concept of health equity index comes into play. So this is a score that has been introduced by the CMS, and what the HEI score essentially does is it kind of enables. Okay, so let me take a pause here. I see Deborah has raised her hand. Go ahead, Deborah. All right, I'll keep going. So, CMS has created this. So CMS has created this score called the Health Equity Index, and it is a quantitative measure to compare how one health plan is doing, or how one health plan compares to another health plan in terms of addressing these health equity disparities. And this is a score that goes from 0 to 1. In my conversations with other counterparts in the healthcare industry, I see folks using a number between 0 to 100 as well, but essentially the way CMS defines it is this is a score between 0 to 1, and some people just multiply this particular number by 100 and then report that particular number. And so if a health plan has a score of 0, then they're doing really bad with regards to the health equity index. If they are at a score of 100, then they're doing really well with regards to health equity. So let's before we talk a little bit more about health equity, I wanted to introduce you to the concept of star ratings. So once again, this is a concept that was introduced by CMS back in 2007, and the star ratings has arguably been one of the best initiatives that the CMS has done in the last 20 years. What star ratings does is it enables consumers, members, and patients like all of us to essentially be able to compare the performance of one health plan with another health plan. And these star ratings essentially goes from 1 through 5. So if a health plan has a star rating of 5, then they're doing really well. If there's a star rating of 1, then this health plan is doing really bad. Now, star ratings is essentially a way for members to essentially compare these health plans one against the other. And a higher star rating plan obviously attracts more members to essentially sign up for it. So it's not only helpful for the health plan for member enrollment purposes, but it is also extremely helpful in terms of securing funding and grants and incentives from the government. The way what HEI has been done is the HEI essentially has a component that feeds into these star ratings, though. So the lower the HEI score of a given health plan, then it will consequently pull down the overall star ratings of a particular health plan. So that's why it is important for every health plan to pay significant attention to how they're doing, not only on their star rating scales, but also through their regular initiatives, but also pay attention to what their HEI score is, and making sure that it is not negatively contributing to their overall star rating score. Next slide, please. So we're going to talk a little bit more about how member engagement strategies can help improve the overall health HEI score of a given health plan. There are various techniques to do so. Out of those various techniques, I have handpicked 4 of those techniques to go in detail and talk more about. And just as a lot of other things in life, there is no one silver bullet here out of these 4 techniques that you see on the screen. In most cases, what needs to happen is you would need to use a combination of many of these techniques in order to improve the HEI score of a health plan. And it kind of goes back to what I said a few slides back. How I described health equity as a concept across various different factors. For example, it could be across race, it could be across socioeconomic status, so on and so forth. So one member engagement technique that actually works really well to address the socioeconomic population strata may not work very well when you're essentially trying to reach members of a certain ethnicity. right? So that's why it's important that the health plan uses a combination of member engagement techniques in order to see where their HEI score is essentially being dragged down, and kind of use an appropriate technique that works to improve their HEI score in that particular sector. Next slide, please. Yeah. So a few minutes back, we talked about the star ratings that the CMS introduced back in 2007. A key component of a health plan star ratings is essentially the HEDIS measures. HEDIS is just a complicated name for talking about care gaps, and I'm sure all of us have a fair understanding of what care gaps are. So I'll take a very simple example, and then we'll go from there. So let's say a health plan has member population over the age of 65, typically the Medicare population, and CDC recommends that all members over the age of 65 get a flu shot during the months of October to March for that particular season. And the way these HEDIS measures work is it is a set of about 96 measures across different medical conditions. And the way it works is it kind of looks at what percentage of members within a particular health plan have closed a certain care gap, right? And if more members have closed that particular care gap, then obviously they score well on their HEDIS measures, right? So a key component of addressing care gaps within a member population is to essentially communicate with those specific members and kind of let them know that they need to take this particular action. So that's where multi-channel communications come into play. So if a certain member is not even notified or is not even aware that he or she needs to take a certain action to close a certain care gap, then chances are that that particular member might never end up closing that particular care gap, right? So multi-channel communications is about being able to reach members across various different communication channels. The typical communication channels that health plans use are emails, text messages, and if at all that particular HEDIS measures contain some sensitive PHI information, then they could use secure email, secure text. Then there are other methods as well, such as push notifications on top of the health plan's app. Um, there are something called as web notifications, which are little snippets of information that show up when the member is logged into on his or her computer. It shows up at the bottom left, at the bottom right, or the top left, top right corner of the browser. And not just digital techniques, sometimes even traditional old print mail techniques work as well. So the idea here is for the health plan to use multi-channel communications to essentially reach out to their members across various factors that we talked about, be able to let them know that that particular member needs to close a certain care gap. So that's what multi-channel communications is all about. And another key component of such a platform should be the ability for the platform to be able to kind of keep track of how these communications are performing. Are the members essentially opening these communications, or they're clicking on links that are going out in these particular communications, so on and so forth. So now let's talk about multi-channel communications with regards to the specific HEI factors that we talked about. So for example, let's say you're trying to address care gaps within socioeconomic status. Then the bottom rung of the socioeconomic status group, most of those members are typically on Medicaid. For those members, text messaging is the best channel to reach them through, right? Whereas if you talk about the higher levels of socioeconomic status, then other channels like print, email, and text as well seems to work. So the idea here is to use a combination of multi-channel communication techniques in order to reach that particular group of population. Next slide, please. So health equity is all about the efficient allocation of resources by directing efforts where they're needed the most. And what better place to start that particular journey than accumulating data about that particular member? So there are various data sources that contribute to that overall member profile that the health plan has. And one of the key techniques of data aggregation happens to be the FHIR standard, the FHIR. So this is a interoperability standard that is very commonly used within healthcare. Most of the providers have adopted to this particular standard. Unfortunately, a lot of health plans are still kind of behind in using this particular standard. But the advantage of using FHIR to aggregate data across various sources is that it's a standardized way of pulling in data. And then if you use FHIR as the standard to aggregate all your data, it makes it very easy to reconcile data that's coming in from various different sources for that same member. And so that is one key technique to essentially, to start with a rich amount of data. And then once you have that rich amount of data, then you start applying techniques like big data, ML, and AI on top of the data to essentially stratify your member population, kind of see which economic groups um, within your member population is not doing well on certain measures, so on and so forth. And so techniques like AI come into play here, where they're able to kind of predict patterns that you're otherwise not able to see. And so, data driven approaches essentially give us a very sound understanding of, which specific subgroups within our population, need to be addressed in order to improve our overall HEI score. Next slide, please. So there are a lot of medical conditions out there for which there is no cure. We just have to, teach the member how to, manage that particular condition better and still lead a healthy life. How do they manage that particular condition without getting into complications, so on and so forth? A key factor in doing so is increasing health literacy. So the idea here is to serve medically validated health education content to these various members, and make sure that they're able to understand when to seek preventive care, how to navigate the healthcare system, so on and so forth. So the key idea here is all of these pieces of health education content need to be at a grade 5 reading level. um, and we see so many content libraries out there, but they don't meet this particular standard of grade 5 reading level. So that is critical in making sure that these members are getting enough on their health literacy initiatives. And the way this kind of ties to HEI initiatives could be, I could use a very simple example here, which is, let's take Hispanic population. And the best way to reach this group of population for this specific initiative is to essentially use content that is fully written in Spanish. um, and so that's these are simple techniques that the health plan can use in order to increase their HEI score for these various subgroups. Next slide, please. Yeah, personalized interventions is about using automated techniques to send out interventions that are very timely and proactive for that particular member. So it's not enough if you just have a multi-channel platform that's able to send messages across these channels, but also need to have some rules driven approaches by which care managers can essentially go in and create their own automated rules for communication. And as and when a particular condition is met, the platform automatically sends out a personalized intervention to that specific member on a select channel. Right. So automation makes a lot of sense for the healthcare entity that's delivering these interventions, because it frees up manual resources to do other tasks. But it also makes a lot of sense for the end member that's receiving these personalized interventions, simply because it's very proactive and timely in nature. So I'll give you a very simple example. So let's say we've got a diabetic population, and then we have a means by which we can kind of figure out when a particular member used that particular diabetes glucose meter device. So we could create a personalized intervention where if the member has not used the device for a couple of days, an automatic message goes to that specific member to remind them to start using that particular device. So that's really what personalized interventions are all about. And like I said, using a rules based platform to create all of these these rules so that it sends out these automated communications goes a long way in increasing a health plan's think about other and we should not limit ourselves to just digital techniques for doing this personalized take care of himself herself, but you do SDOH integration, then you could think about other non-digital techniques as well for these interventions, such as there could be a certain member who really wants to take care of himself herself, but has some transportation issues, so on and so forth. And that is one other category of personalized today. I know it's a very it's a very short amount of time in order to help convey a lot of information. Next slide, but we wanted to open this up for awesome. So yeah, so that's about what we have time today. I know it's a very it's a very short amount of time to convey a lot of information. Um, but we wanted to open this up for Q&A from the audience.
Okay, I'll get the ball rolling with a quick question. So, Sai, what challenges have you encountered when implementing multi-channel communication strategies to enhance engagement among diverse populations? Okay, and I'll get the ball rolling with a quick question.
So that's a great question,
So,
Zakia.
Sai, what challenges
So
have you
one of
encountered
the
when
one of the key
implementing
challenges that we
multi-channel
experience
communication
whenever
strategies
we
to
integrate our
enhance
solution
engagement
with a
among
health
diverse
plan to do some
populations?
of these
And
multi-channel
how are
outreach
these
strategy
challenges addressed?
is so that's a great question, Zakia. Right. So one of the key challenges that we experience whenever we integrate our solution with a health plan to do some of these multi-channel outreach strategy is bad or wrong data. Right. So sometimes what happens, or not sometimes, many times what happens is you are getting data from the health plans, eligibility files, they push out phone numbers, email addresses, and then when the campaign or the automated intervention goes out for that particular member, then we kind of figure out that the phone number that we have on that particular member is actually wrong. So because we're getting bounce backs from that particular phone number, so chances are that the member moved to a different phone number and they just forgot to update the problem. So bad or wrong data is one of the key challenges that we experience when we start implementing multi-channel engagement strategies with the health plan. And so what the typical fix for this particular problem is to have automated strategies saying that, hey, we are trying to reach you by text text. There is an automated campaign that's pre-created on the platform, but however what that does is it automatically sends out an email to that particular member if we have the email address on file saying that, hey, we are trying to reach you by text messages and we're trying to reach you at this particular number, but however we're getting bounce backs from that particular number. Can you please click on this form, go ahead and update your phone number so that we can update our system to reach. So that's sort of how we tackle that particular challenge. So this is one other challenge that we come across is sometimes health plans have collected all of this information, but they have not gotten the explicit consent from the member to reach back out to them, to reach out to them. Once again, we use this is essentially the consent information, and both the email and text rules say that you need to get consent from that particular member before you can start sending out communications. And so once again, we use techniques like, okay, if we already have consent obtained on a different channel, then we can send out an automated email saying that, okay, hey, we're looking to get consent from you to start sending out text messages as well. So wrong data, bad data, and then getting consent information are essentially some of the most
We do
common
have a
problems
question in
that
the
we
chat
come
from
across when
David.
implementing
So David wants
multi-channel strategies.
to know if can you talk more about the fire and various thank you for data sources that can be used. Before I ask my next question, I'll
Yeah.
pause really quickly.
So as
Oh,
I
we do have a
said,
question in the
fire
chat
is
from
an
David.
interoperability standard.
So
We,
David
we
wants
see pretty good
to know
adoption
if
of fire
can you
standard
talk more
among
about the
provider
fire and
entities. We see
various
pretty good
data
adoption
sources
among
that
all
can
of
be
the other
used?
peripheral
Yeah.
systems outside
So
of payers
as
and
I
providers.
said,
What I
fire
mean
is
by
an
that is
interoperability
like
standard.
we see pretty good adoption of fire standard among
However,
provider
what seems to
entities.
have
We
been
see pretty good
lacking
adoption
is the
among all
adoption
of the
of
other
fire among the health
peripheral
plan entities. So
systems
there's far
outside of
less
payers and
fire
providers.
adoption
What I mean by
among
that
the
is
health
like
plan
currently
companies disease
than
management
in some of
companies,
these
other
labs, so on
other
and so forth.
uh,
However, what seems to have
entities.
been lacking
So
is
the
the
idea
adoption
behind using
of
fire
is
among
to
the health
essentially
plan
use it.
communities.
So
So
there's
there's
far
far
less
less
fire
fire
adoption
pull
among
members
the health
across
plan
these various
community than in
entities
some
into
of
one
these
source.
other
So
other
there are
uh,
different kinds of
entities.
approaches with regards to
So
fire
the idea
mitigation.
behind
So
using
there could
fire
be
is to
pull versus
essentially
push
use a
approach,
standardized data set
where you
to
could essentially
communicate
query a
pull
fire
members
server that the
across
health
these
entity
various
has in order to pull
entities into one
information for a
source.
certain member.
So there
We've
are
also
different kinds
support
of
the other
approaches with
push method
regards
of
to fire
integration,
integration.
where
So there could
the
be a pull
entity
versus a push
they
approach
can push
where
out
you could essentially
updates using
query a fire server
APIs.
that the health
They
entity
can
has
post
in order
fire
to pull
updates
information
to
for a
the fire
certain
server
member.
that we have within
We've
our
also
cloud.
support the other
So that
push
is the
method
push
of
approach.
integration where
Using a
the
combination of
entity
approaches,
they
then
can push
you
out
essentially try to
updates
aggregate
using
data from various
APIs.
sources using the fire
They can
standard. And
post
one
fire
more point to
updates
mention
to the
here
fire server that
is if
we
you
have
use the
within
fire standard, and once
our
again,
cloud. So
taking a
that
step
is the
back,
push
fire is
approach.
essentially
So
just a
using a
regular API.
combination of approaches,
It is
then
just a regular
you
API.
essentially
It
try to
contains the
aggregate
JSON
data
data
from
set.
various sources
It's just
using the
that it
fire
is
standard.
a
And one
standard
more
format
point to
that has
mention
about
here
26
is if
resources
we
within
use
that
the fire
particular
standard
once again,
structure,
so for
taking a
example,
step
let's
back, fire
say
is
a
essentially
healthcare
just a
entity
regular
wants to
API.
push out something like a care plan.
It is just a
Rather than
regular
create their
API.
own
It
data
contains
structure
the
to push
JSON
that
data
particular
set.
care plan, they
It's
just
just that
adhere
it
to
is a
fire
standard
standard.
format. It has
So
about
where it's
26
very useful
resources
because
within that
everyone is
particular
following this
structure.
standardized data
So, for
set
example, let's
is in
say
kind of
a health plan
reconciling
entity
data
wants to push out something like a care
across
plan.
the
Rather than
various
create their
aspects of
own
that
data
particular
structure to push
member's
that particular
healthcare
care
history.
plan, they just adhere to this particular fire standard. So,
Thanks,
where
Sai.
it's very
Great
useful because
information.
everyone is
Awesome.
following
Thanks,
the
David.
standardized data set is in kind of reconciling data across the various
We have
aspects of
about
that
2 more
particular
minutes
member's
left.
healthcare history.
Do we have any other questions from the audience?
Thanks, Sai. Great information.
Awesome. Thanks, David.
Awesome. All right, I'll post another really quick question. Do we have any other questions from the examples of successful personalized intervention that have significantly improved health outcomes in vulnerable populations?
Absolutely. Once
All right,
again, that's a
I'll
great
post
question,
another really quick
Zikea.
question.
So,
So Sai, can you share
like I said,
examples
personalized
of
interventions is about
successful
automated
personalized
interventions that
intervention
are timely
that
and
have
proactive for
significantly
that
improved
particular
health
member.
outcomes in vulnerable
So, we
populations?
all know how absolutely. Once again, that's a great question, Zikea.
There are many
So,
ER visits that could be avoided.
like I
If
said,
that particular
personalized
member
interventions is about
is
automated
his or her
interventions that are
medications.
timely and
There's
proactive
a
for that
recent stat
particular
that I came
member.
across, IKEA, about
So,
20 to
we all
30%
know
of
how important
hospitalizations
medication
can essentially
adherence
be
is.
avoided if a particular
There
member
are
is adherent,
many
right?
ER
Now,
visits that could
let's
be
assume you
avoided
use
if
a
that
technology
particular
platform
member is
to
adherent
send
to
out
his or her
reminders to a certain
medications.
member,
There
collect
is a
information
recent stat
that
that I came
particular member
across,
on whether
IKEA,
the
about
member
20
took
to
his or
30%
her
of
medication on time,
hospitalizations
right?
can essentially be
And
avoided
you
if a
can then
particular
go
member
ahead
is
and create
adherent.
an
Right?
automated,
Now, let's assume you use a technology
workflow
platform
on the
to
technology
send out
platform
reminders
that
to a certain member,
allows you
collect
to essentially
information from
say,
that
hey, if the
particular
member
member on
has
whether the
missed
member took his
medications
or her
3 days
medication
in
on
a row,
time, right?
then
And
you
you
send
can
a
then
reminder
go
to
ahead
that
and
particular
create an
member.
automated
Then if we don't hear back
a
from the
workflow
member for
on
another
the
3 more days,
technology
can we send an
platform that
automated reminder
allows
to the
you to
caregiver
essentially
of that
say,
member?
hey, if the member
So
has
this is a
missed
classic
medications
example
three
of
days in a
personalized
row,
intervention where the health
then
coach is not
send a reminder to
manually
that
involved in
particular
sending out
member.
these
Then
reminders
if we don't
based
hear
on the
back
data that is coming
from
back from
the
that
member
particular
for another
member.
3 more
The
days, can
system
we
is
send an
automatically
automated
able to say,
reminder to
okay,
the
I've not
caregiver of
heard,
that particular member?
any
So this is a
responses
classic
from this
example
member
of
for 3
personalized
days. I'll
intervention where
automatically
the
send
health
out a
coach is
reminder
not
for this
manually involved in sending out these reminders based on the data that is coming back from that another example member. That the system is automatically able to say, okay, I've not heard any responses from this member for 3 days. I'll automatically send out a reminder for this. And let's say we're getting right. So that is one great example. Another example that we've implemented this one is diabetes automated workflows can use case for many HEDIS measures. And let's say we're getting continuous stream of blood glucose readings from members, and if a particular reading is extremely high, or if a series of readings are extremely high, then automated workflows can be created on the platform to essentially send out a notification to that specific member with a piece of educational content. Just common examples where personalized interventions. So this is a combination of both the personalized reminding the member that he or she needs, and also a combination of the health literacy and to keep up with his or her health. So these are just common examples where personalized interventions go a long way in automatically reminding the member that he or she needs to do a certain action in order to keep up with his or her health.
So as we wrap up today's session of Road to Wellbeing, I want to thank you so much for that, Sai. You provided a lot of great information. We are now at our time. Thank you all for hanging on just a minute over. So as we wrap up today's session of Road to Wellbeing, I want to thank each and every one of you for joining us. Your dedication to fostering a more on health equity and inclusive. We've explored the significance of the Health Equity Index by implementation strategies to enhance equity, and we've examined the role of data-driven approaches in your workforce and ensuring your dedication to fostering a more equitable and inclusive workplace is what will drive meaningful change. By implementing the strategies discussed today, we look forward to seeing you can take actionable steps toward improving the well-being of your workforce and ensuring that every employee has the opportunity to thrive. Thank you. We hope you leave this session with new insights and practical tools to apply within your organization. We look forward to seeing you in the future episodes of the Road to Wellbeing series. We'll continue to explore innovative ways to support holistic employee well-being. Thank you, and until next time, let's keep moving forward on the road to well-being. Feel free to follow us on LinkedIn for our future webinars. Have a great day, everyone.
Thanks, Zikea. Bye-bye.